Which anticoagulant is most appropriate for a plasma ammonia test? A. Sodium citrate. B. Lithium heparin. C. Sodium fluoride. D. Potassium oxalate. Answer B. Lithium heparin prevents clotting while preserving analytes such as ammonia. Other anticoagulants may interfere with accurate results. A peripheral smear shows hypersegmented neutrophils. Which deficiency is most likely? A. Vitamin B12 deficiency. B. Iron deficiency. C. Vitamin K deficiency. D. Folate deficiency. Answer A. Hypersegmented neutrophils are a hallmark of megaloblastic anemia caused by vitamin B12 or folate deficiency, with B12 being more common. Which biosafety level is required for working with Mycobacterium tuberculosis? A. BSL-1. B. BSL-2. C. BSL-3. D. BSL-4. Answer C. Tuberculosis requires BSL-3 containment due to its airborne transmission risk and pathogenicity. The osmotic fragility test is used to evaluate which condition? A. Hemophilia A. B. Sickle cell anemia. C. Hereditary spherocytosis. D. Polycythemia vera. Answer C. Spherocytes are more fragile in hypotonic solutions, making osmotic fragility testing diagnostic for hereditary spherocytosis. Which of the following is the confirmatory test for HIV infection? A. ELISA. B. Western blot or immunoblot. C. Rapid antigen test. D. Agglutination assay. Answer B. ELISA is a screening test, while Western blot or immunoblot serves as a confirmatory test due to its higher specificity. What is the primary stain used in the Ziehl-Neelsen acid-fast method? A. Safranine. B. Crystal violet. C. Carbolfuchsin. D. Methylene blue. Answer C. Carbolfuchsin penetrates the waxy cell wall of acid-fast organisms such as Mycobacterium. A sample stored for potassium testing shows falsely elevated results. What is the likely pre-analytical cause? A. Hemolysis. B. Cold storage. C. Insufficient centrifugation. D. Lipemia. Answer A. Hemolysis releases intracellular potassium into serum or plasma, producing falsely high values. The Schilling test is historically used to diagnose deficiency of which vitamin? A. Vitamin D. B. Vitamin K. C. Vitamin B12. D. Vitamin C. Answer C. The Schilling test evaluates vitamin B12 absorption, distinguishing between dietary deficiency and intrinsic factor deficiency. What is the clinical significance of a positive nitrite test in urinalysis? A. Indicates dehydration. B. Suggests bacterial infection. C. Reflects high protein intake. D. Suggests renal failure. Answer B. Many gram-negative bacteria reduce nitrate to nitrite, making a positive nitrite test indicative of urinary tract infection. Which confirmatory stain is used to verify glycogen in cells? A. Sudan black B. B. Periodic acid Schiff, PAS. C. Wright-Giemsa. D. Gram stain. Answer B. PAS specifically stains polysaccharides such as glycogen, helping in diagnosis of storage diseases and leukemias. Which electrolyte imbalance is most commonly associated with hemolyzed samples? A. Hypocalcemia. B. Hyperkalemia. C. Hyponatremia. D. Hypomagnesemia. Answer B. Hemolysis causes release of intracellular potassium, falsely increasing measured levels. Which hepatitis virus is transmitted primarily through contaminated water? A. Hepatitis A. B. Hepatitis B. C. Hepatitis C. D. Hepatitis D. Answer A. Hepatitis A spreads via the fecal-oral route, often from contaminated water or food. Which immunoglobulin is produced first during an acute infection? A. IgA. B. IgM. C. IgG. D. IgA. Answer B. IgM is the first antibody produced in response to infection and indicates recent exposure. The primary function of fibrinogen in coagulation is to A. Activate platelets. B. Enhance thrombin production. C. Stimulate plasmin. D. Form fibrin mesh. Answer D. Fibrinogen is converted into fibrin strands by thrombin, creating a stable clot. What is the purpose of using quality control material in clinical laboratories? A. To replace calibration. B. To monitor test accuracy and precision. C. To test new instruments only. D. To eliminate human error. Answer B. Quality control ensures test reliability by detecting errors and maintaining accuracy and precision. Which red blood cell morphology is strongly associated with liver disease? A. Target cells. B. Sickle cells. C. Spherocytes. D. Schistocytes. Answer A. Target cells, podocytes, commonly appear in liver disease due to altered lipid metabolism. The principle of spectrophotometry is based on A. Heat absorption. B. Light scattering. C. Light absorption at specific wavelengths. D. Radioactive decay. Answer C. Spectrophotometry measures light absorbed by a solution at a specific wavelength to determine analyte concentration. What is the significance of a positive Coombs test? A. Indicates clotting disorder. B. Detects antibodies attached to red blood cells. C. Suggests bacterial infection. D. Identifies liver dysfunction. Answer B. A positive Coombs test indicates immune-mediated hemolysis due to antibodies binding to RBCs. Which analyte is most affected if a sample is left uncentrifuged for several hours? A. Glucose. B. Sodium. C. Calcium. D. Urea. Answer A. Cells in unseparated samples continue to metabolize glucose, leading to falsely low results. A gram stain of cerebrospinal fluid shows gram-negative diplococci. The most likely pathogen is A. Neisseria meningitidis. B. Streptococcus pneumoniae. C. Haemophilus influenza. D. Escherichia coli. Answer A. N. Meningitis is a common cause of bacterial meningitis and appears as gram-negative diplococci. A hemoglobin electrophoresis reveals HBS. Which condition is diagnosed? A. Thalassemia. B. Sickle cell disease. C. Iron deficiency anemia. D. Polycythemia vera. Answer B. Hemoglobin S is abnormal and diagnostic of sickle cell disease or trait depending on percentage. In molecular diagnostics, PCR amplification requires A. RNA polymerase. B. Heat-stable DNA polymerase. C. Reverse transcriptase only. D. DNA ligase? Answer B. PCR uses heat-stable DNA polymerase, Taq polymerase, to amplify DNA sequences. Which blood group antigen is most immunogenic after ABO? A. Lewis. B. Kel. C. Rh, D antigen. D. Duffy. Answer C. The Rhd antigen is highly immunogenic and causes severe hemolytic transfusion reactions. Which urine crystal is associated with ethylene glycol poisoning? A. Cysteine. B. Uric acid. C. Calcium oxalate. D. Struvite. Answer C. Calcium oxalate crystals, especially envelope-shaped, are seen in ethylene glycol ingestion. What is the role of troponin testing in clinical chemistry? A. Evaluates kidney function. B. Detects acute myocardial infarction. C. Measures electrolyte balance. D. Screens for liver disease. Answer B. Troponin is a highly specific marker for myocardial damage and is essential in diagnosing heart attacks. Which laboratory parameter is most affected in hemophilia A? A. PT, prothrombin time. B. Bleeding time. C. Platelet count. D. APTT, activated partial thromboplastin time. Answer D. Hemophilia A results from factor VIII deficiency, prolonging APTT but leaving PT normal. What does a decreased albumin to globulin ratio suggest? A. Dehydration. B. Immunoglobulin overproduction. C. Liver hyperfunction. D. Hypoglycemia. Answer B. A low A/G ratio indicates increased globulin, immunoglobulins, often due to multiple myeloma or chronic inflammation. Which test differentiates between Staphylococcus aureus and Staphylococcus epidermidis? A. Catalase test. B. Oxidase test. C. Gram stain. D. Coagulase test. Answer D. S. aureus is coagulase positive, while S. epidermidis is coagulase negative. The respiratory count is useful in evaluating A. Kidney filtration rate. B. Bone marrow activity. C. Liver function. D. Clotting efficiency. Answer B. Respiratory count indicates bone marrow response to anemia or blood loss. What is the main purpose of performing proficiency testing in a laboratory? A. To train new staff. B. To reduce patient costs. C. To test instrument durability. D. To compare laboratory performance with peers. Answer D. Proficiency testing ensures laboratory accuracy by comparing results with other accredited labs, maintaining quality standards.